Hi, my name is Kim Gallen, and I'm a health informatics consultant, and I'm presenting an evaluation plan for a CDS for a local health organization that has been using a CDS to help with off-the-shelf drug interaction and drug allergy alerting. The CDS is a source of significant clinician complaints due to the rate of false positive alerts. And today we're going to evaluate or offer a plan for evaluating this system. Before we talk about the evaluation plan, it's really important to ground our evaluation in a common definition of clinical decision support system, or CDSS. Now, CDSS is any computer program designed to help professionals make clinical decisions. They're used for the following purposes. Now, they provide customized assessments or advice based on sets of patient-specific data. They suggest differential diagnoses. They offer advice about additional tests and examinations. They give clinicians an opportunity to provide really good treatment advice based on data in terms of whether it's a treatment will be therapy, surgery, or other medical procedures. They also help alert pharmacy systems alert providers of possible drug interactions or incorrect drug dosages. And finally, they're designed to remind the physician of diagnoses or problems that might be overlooked. Again, we're here today to offer a plan as to you as a local health organization that has been having difficulty with the CDSS that's been giving a rate of false positive alerts around drug interaction and drug allergy alerting. Now, let's talk about the benefits of using a CDSS and the role in decision making around drug interaction. Because physicians have limited resources and there is increased demand on their time, physicians are often overwhelmed and they often need help in supporting and alerting them to patients who may have a drug allergy or some adverse drug effect, right? Many doctors have insufficient time available for diagnosis and treatment, and so they may prescribe a drug that actually is going to have a detrimental effect on a patient, right? And so this particular CDSS is really incredibly important. It offers physicians an opportunity to prescribe medicine knowing that if there is an issue in the electronic health record, it will alert them so that they don't prescribe this medicine to the particular patient, right? So CDSSs, they actually create and help improve healthcare processes and their outcomes in a variety of different scenarios. Now, in terms of our evaluation plan, we really need to start off by talking about the stakeholders. Who are our stakeholders in this particular plan? Well, our stakeholders are going to be the end user. They're going to be the physicians, the nurse, the patients, the lab techs, the pharmacy techs, right? These end users are really incredibly important because we are going to evaluate their interaction with this CDSS. We're also going to look at the project manager who tracks the evaluation project that includes the schedule and the productive use of resources and budget. We're going to take it all the way back to the product owner, right, who is focused on features and costs. We'll look at the product developer and also see the product developer as a stakeholder who actually developed the CDSS. And then finally, we're going to consider the system architect a stakeholder also who needs to integrate the CDSS into the overall system. When we think about CDSS tools, we can really break them down into two larger categories: passive systems and active systems. Passive systems is when the user has total control. They actually enter in data, it's standalone, it's initiated by users, it's initiated by the system. We're dealing with an active system for our CDSS in this local health organization. In this case, the user has partial control. It's really the system giving advice. The user evaluates the advice and determines whether they're going to accept or reject it. Now, characteristics of this active system includes data entry consultation style. It's integrated into the electronic health record or into a lab or pharmacy system, and is related to the major application of the technology, right? The application, if you want to call an electronic health record, or some other systematic technology, it's going to be integrated into that as a part of the system. Now, our key evaluation questions are going to be how accurate or not is the CDSS and what is its role on clinical efficacy? How is it impacting a clinician's ability to provide effective care? And then what data might we use available to measure this effectiveness? That's going to be also part of our evaluation plan as well. Our second evaluation is more on the patients. How is this alerting of false drug allergy interaction or false positive alert impacting a patient's opportunity to actually get the medicine they need? How is it impacting other aspects of the healthcare? Now, our areas of prioritization is going to be evaluation of the user's needs. We'll also be looking at the top management support. How are they able to provide support when we have these false positive alerts? What are the commitment of the experts, the product developer, the system architect? What are the integration issues, right? Is this about an integration issue into the electronic health record? Is there a human-computer interface problem? Maybe this is a problem of the clinician not knowing how to enter the information. Is this an incorporation of a particular type of domain of knowledge, right? Maybe there's areas of knowledge around drug alerting and drug interaction that is outside of a particular clinician's purview. And finally, we're going to consider the social organizational context of the CDSS. Now, the theoretical approaches and models of evaluation that we're going to give is use our information theory. We are going to look at the information source, and that information source in this case is that point of entering the information into the system, right? Then we're going to look at the transmitter or how that information is transmitted and look at the information pipes. Then we're going to look at the receivers, right? Which are the clinicians, and we're going to look at the destination of how the clinicians are receiving this information and what might be the difficulty in that transmittal, right? So it's really important in information theory to look at the transmitter and the communication of the information, and then look at the information source and how it's transmitted through these different pipelines or channels, right? Because it may be that in this case, it's the channel that's the issue. We're going to use a management-focused evaluation, which assesses the impact and effect of a CDS in the overall organization. We think it's going to generate insight into related workflow, disruption, productivity, impact, and process changes. And we hope to use these findings to refine and modify that workflow or that communication. We'd like to identify bottlenecks or disruptions in service. And we hope that through this, we'll be able to look at the issue and then refine and then develop newly gained efficiencies. Now, the type of evaluation overall we're going to do is a summative evaluation, which assesses outcome and effectiveness. This will allow us to potentially focus on some clinical outcomes. We'll do this by observational studies, which is looking at case series, a particular set of cases of false positive. We'll look at cost-benefit analysis. How much is this costing clinicians and the overall healthcare system? And then we'll do a meta-analysis. Now, it's important to note that there may be some challenges, right? The CDSS is integrated into the EHR, or the electronic health record, so we'll have to disaggregate that. We'll also have to make sure there's not contamination where clinicians are treating patients and different types of patients, and false positives are not coming up for them in certain cases, and that's contaminating the case series where there are false positives. We'll definitely need special analytics expertise to actually disaggregate and analyze the data. We need to make sure that the CDS is actually being used on a regular basis to give us enough cases to analyze, and we'll need permission needed if there's any randomized controlled trials. So we're hoping that together with all of this approach, we'll be able to effectively look at the issues with this CDSS and create an opportunity to increase its efficacy. Thank you for your time and the opportunity to present the evaluation plan. Have a good evening.